Hives, also known as urticaria, are red, itchy welts that can appear suddenly on the skin. They're often triggered by allergic reactions, stress, or even unknown causes. While hives are usually harmless and temporary, they can be uncomfortable and sometimes distressing. Understanding what causes hives is the first step in lowering your risk. In this video, we'll explore evidence-based strategies to reduce your chances of developing hives, focusing on practical lifestyle changes and medical advice. Let's start by looking at what hives are and why they occur. Hives can be triggered by a variety of factors. The most common include certain foods, medications, insect stings, and environmental allergens like pollen or pet dander. Physical triggers such as heat, cold, or pressure on the skin can also play a role. Sometimes, emotional stress or infections can set off an outbreak. Knowing your personal triggers is crucial in managing and preventing hives. By identifying and avoiding these triggers, you can significantly lower your risk of experiencing hives. Food allergies are a leading cause of hives. Common culprits include nuts, shellfish, eggs, and dairy products. If you suspect a food is causing your hives, try keeping a food diary to track what you eat and any reactions you experience. Consulting with an allergist can help pinpoint specific food triggers. Once identified, avoiding these foods is a key step in preventing future outbreaks. Remember, evidence shows that careful dietary management can make a big difference in reducing hives risk. Certain medications can cause hives as a side effect. Common offenders include antibiotics, nonsteroidal anti-inflammatory drugs, NSAIDs, and some blood pressure medications. If you notice hives after starting a new medication, contact your healthcare provider immediately. Never stop taking prescribed medication without consulting your doctor. Your provider can help determine if a medication is the cause and suggest alternatives if necessary. Being aware of medication triggers is an important part of hives prevention. Environmental allergens such as pollen, dust mites, pet dander, and mold can trigger hives in sensitive individuals. To lower your risk, keep your living space clean and well ventilated. Use air purifiers and wash bedding regularly. If you have pets, consider keeping them out of bedrooms and off furniture. During high pollen seasons, keep windows closed and shower after spending time outdoors. These evidence-based steps can help minimize your exposure to common allergens. Physical factors like heat, cold, sunlight, or pressure on the skin can sometimes cause hives. For example, tight clothing or prolonged standing can trigger pressure-induced hives. To reduce risk, wear loose, comfortable clothing and avoid extreme temperatures when possible. If you notice hives after exercise or exposure to the sun, try modifying your routine or using protective clothing. Being mindful of these physical triggers can help you prevent outbreaks. Emotional stress is a well-known trigger for hives in some people. Stress can weaken your immune system and make your skin more reactive. Evidence suggests that practicing stress management techniques like mindfulness, meditation, or yoga can help reduce the frequency and severity of hives. Regular exercise, adequate sleep, and maintaining a healthy work-life balance are also important. By managing stress effectively, you can lower your risk of hives and improve your overall well-being. Some viral or bacterial infections can trigger hives, especially in children. Practicing good hygiene, such as frequent hand washing and avoiding close contact with sick individuals, can help reduce your risk. If you develop hives during or after an illness, consult your healthcare provider for guidance. Vaccinations and prompt treatment of infections are also evidence-based ways to minimize the risk of infection-related hives. Certain chemicals and skincare products can irritate the skin and trigger hives. Fragrances, dyes, and harsh detergents are common culprits. To lower your risk, choose hypoallergenic products and avoid those with strong scents or unnecessary additives. Patch testing new products on a small area of skin before full use is a good preventive measure. Evidence supports using gentle, fragrance-free products to maintain skin health and reduce hives risk. Chronic hives, or chronic urticaria, last for more than 6 weeks and can be particularly challenging. The cause is often unknown, but autoimmune factors may play a role. If you experience chronic hives, it's important to work closely with a healthcare provider. Evidence-based treatments include antihistamines and, in some cases, other medications. Keeping a symptom diary and following your doctor's advice can help manage chronic hives and reduce flare-ups. Antihistamines are the first-line treatment for hives and can also be used preventively in some cases. These medications block the action of histamine, a chemical released during allergic reactions that causes itching and swelling. Taking a non-sedating antihistamine daily, as recommended by your doctor, can help prevent hives in people with frequent outbreaks. Always follow your healthcare provider's instructions regarding dosage and duration. For people with severe allergies that trigger hives, allergen immunotherapy may be an option. This treatment involves regular exposure to small amounts of the allergen to build tolerance over time. Immunotherapy is evidence-based and can reduce the frequency and severity of allergic reactions, including hives. It's important to discuss this option with an allergist to determine if it's appropriate for your situation. Maintaining a healthy lifestyle can support your immune system and lower your risk of hives. This includes eating a balanced diet, staying hydrated, exercising regularly, and getting enough sleep. Avoiding tobacco and limiting alcohol intake are also important. Evidence shows that a healthy lifestyle not only reduces the risk of hives, but also benefits your overall health and well-being. Staying well hydrated is essential for healthy skin and immune function. Drinking enough water helps flush out toxins and keeps your skin barrier strong, which may reduce the likelihood of hives. Aim for at least 8 glasses of water a day, or more if you're active or in hot weather. Evidence supports the role of hydration in maintaining overall health and potentially lowering hives risk. Adequate sleep is vital for a healthy immune system. Poor sleep can increase inflammation and make your body more susceptible to allergic reactions, including hives. Aim for 7 to 9 hours of quality sleep each night. Establishing a regular sleep schedule and creating a restful environment can help. Evidence links good sleep hygiene with reduced risk of hives and better overall health. Regular physical activity boosts your immune system and helps manage stress, both of which can lower your risk of hives. Choose activities you enjoy, such as walking, swimming, or yoga. However, if you notice hives after exercise, consult your doctor, as some people experience exercise-induced urticaria. Evidence supports the role of moderate exercise in reducing allergic reactions and improving overall health. Maintaining a healthy work-life balance can help reduce stress and lower your risk of hives. Overworking and chronic stress can weaken your immune system, making you more susceptible to allergic reactions. Set boundaries, take regular breaks, and make time for hobbies and relaxation. Evidence shows that managing stress through work-life balance is beneficial for both physical and mental health. If you experience recurrent hives, allergy testing can help identify specific triggers. Skin prick tests and blood tests are commonly used to detect allergies to foods, environmental factors, or medications. Evidence supports allergy testing as a valuable tool in managing and preventing hives. Discuss testing options with your healthcare provider to develop a personalized prevention plan. Patch testing is a method used to identify contact allergens that may trigger hives. Small amounts of potential allergens are applied to the skin under adhesive patches, and reactions are monitored over several days. This evidence-based approach can help pinpoint substances in cosmetics, detergents, or other products that cause hives. If you suspect a contact allergy, ask your doctor about patch testing. Keeping a symptom diary can help you and your healthcare provider identify patterns and triggers for your hives. Record details such as foods eaten, activities, medications, and emotional states when hives occur. Over time, this information can reveal important clues and guide prevention strategies. Evidence supports the use of symptom diaries in managing chronic conditions like hives. A gentle skincare routine can help prevent irritation and reduce the risk of hives. Use mild, fragrance-free cleansers and moisturizers. Avoid hot showers and harsh scrubbing, which can damage the skin barrier. Pat your skin dry with a soft towel and apply moisturizer while the skin is still damp. Evidence shows that proper skincare supports skin health and may lower hives risk. Choosing the right clothing can help prevent hives, especially if you're sensitive to pressure or certain fabrics. Opt for loose-fitting, breathable clothes made from natural fibers like cotton. Avoid tight belts, straps, or synthetic materials that may irritate your skin. Evidence suggests that comfortable clothing reduces the risk of pressure-induced or contact hives. Extreme temperatures can trigger hives in some people. To lower your risk, avoid hot baths, saunas, or prolonged exposure to cold. Dress appropriately for the weather, and use fans or air conditioning to stay cool in hot environments. Evidence supports temperature control as an effective strategy for preventing temperature-induced hives. Sun exposure can trigger hives in some individuals, a condition known as solar urticaria. To protect yourself, wear sunscreen, hats, and protective clothing when outdoors. Seek shade during peak sunlight hours. Evidence shows that sun protection reduces the risk of sun-induced hives and supports overall skin health. Scratching hives can worsen symptoms and increase the risk of infection. Try to avoid scratching by keeping your nails short and using cool compresses to soothe itching. Over-the-counter anti-itch creams or oral antihistamines can also help. Evidence supports these measures in reducing discomfort and preventing complications from hives. While most hives are harmless, some symptoms require immediate medical attention. If you experience difficulty breathing, swelling of the face or throat, or dizziness, seek emergency care right away. These can be signs of a severe allergic reaction called anaphylaxis. Evidence-based guidelines stress the importance of recognizing these warning signs and acting quickly. If you have a history of severe allergic reactions, your doctor may prescribe an epinephrine autoinjector. Carry it with you at all times and know how to use it. Inform friends, family, and coworkers about your allergy and what to do in an emergency. Evidence supports preparedness as a key factor in preventing serious complications from hives and allergies. Regular checkups with your healthcare provider can help monitor your health and catch potential issues early. Discuss any new or worsening symptoms and update your provider on any changes in your lifestyle or medications. Evidence shows that proactive healthcare reduces the risk of complications from hives and other allergic conditions. A family history of allergies or hives can increase your risk. While you can't change your genetics, being aware of your family history can help you and your doctor develop a personalized prevention plan. Evidence suggests that early identification of risk factors leads to better management and prevention of hives. Some cases of chronic hives are linked to autoimmune conditions, where the immune system attacks the body's own tissues. If you have other autoimmune diseases, your risk for hives may be higher. Evidence-based management includes regular monitoring and working with specialists to control underlying conditions, which can help reduce hives risk. Hormonal changes, such as those during pregnancy, menstruation, or menopause, can sometimes trigger hives. If you notice a pattern, discuss it with your healthcare provider. Evidence suggests that managing hormonal fluctuations and related symptoms can help reduce the risk of hives in susceptible individuals. Children are more likely to develop hives due to infections or food allergies. Parents should monitor for symptoms and keep a record of potential triggers. Evidence-based prevention includes good hygiene, avoiding known allergens, and consulting a pediatrician if hives occur. Early intervention can help manage symptoms and prevent recurrence. Older adults may be more sensitive to medications and environmental factors that can trigger hives. Regular medication reviews and maintaining a clean living environment are important. Evidence supports tailored prevention strategies for the elderly, including consulting healthcare providers about all medications and potential interactions. Traveling can expose you to new allergens, foods, and environments that may trigger hives. Pack necessary medications, research local foods, and be prepared for emergencies. Evidence-based advice includes carrying a medical alert card and knowing how to access medical care while abroad. These steps can help you enjoy travel while minimizing hives risk. Pets can be a source of allergens that trigger hives. If you're allergic, consider allergy-proofing your home by using HEPA filters, keeping pets out of bedrooms, and bathing them regularly. Evidence supports these measures in reducing allergen exposure and lowering the risk of hives for pet owners. Mold and dust mites are common indoor allergens that can trigger hives. Keep your home dry and clean, use dehumidifiers, and wash bedding in hot water weekly. Evidence shows that controlling indoor allergens is effective in reducing hives risk, especially for those with known sensitivities. Some people are sensitive to fragrances in perfumes, cleaning products, or air fresheners, which can trigger hives. Choose fragrance-free or hypoallergenic products and ventilate your home regularly. Evidence supports minimizing fragrance exposure to lower the risk of hives in sensitive individuals. Laundry detergents and fabric softeners can contain chemicals that irritate the skin and trigger hives. Use gentle, hypoallergenic detergents and rinse clothes thoroughly. Evidence shows that switching to milder products can help prevent hives in people with sensitive skin. Cosmetics and personal care products can sometimes cause hives, especially if they contain allergens or irritants. Choose products labeled as hypoallergenic and avoid those with unnecessary additives. Patch test new cosmetics before full use. Evidence supports careful selection of personal care products to reduce hives risk. Seasonal changes can bring new allergens, such as pollen in spring or mold in fall, which may trigger hives. Monitor local allergen forecasts and take preventive measures, like keeping windows closed and using air purifiers. Evidence supports adapting your routine to seasonal changes to lower hives risk. Protecting yourself from harsh weather conditions can help prevent hives. Wear appropriate clothing for cold, windy, or rainy weather, and use moisturizers to protect your skin. Evidence suggests that weather protection is an effective strategy for those prone to weather-induced hives. Joining a support group or online community for people with hives can provide valuable information and emotional support. Sharing experiences and tips can help you feel less alone and more empowered to manage your condition. Evidence shows that social support improves coping and quality of life for people with chronic health issues. Rely on trustworthy sources for information about hives and their prevention. Consult healthcare professionals, reputable websites, and scientific literature. Avoid misinformation, which can lead to ineffective or harmful practices. Evidence supports the importance of accurate information in managing and preventing hives. Prevention strategies for hives should be tailored to your individual risk factors and triggers. Work with your healthcare provider to develop a plan that fits your lifestyle and needs. Evidence shows that personalized approaches are more effective in reducing hives risk and improving outcomes. Lowering your risk for hives involves a combination of lifestyle changes, trigger avoidance, and medical management. By understanding your personal risk factors and following evidence-based prevention strategies, you can reduce the frequency and severity of hives. Remember to consult your healthcare provider for personalized advice and stay informed with reliable information. Taking proactive steps today can help you enjoy healthier, more comfortable skin in the future.